Hello, my name is Angelina, and my case study topic is Multistate Outbreak of Salmonella, Tennessee, Infections Linked to Peanut Butter. According to the Food, Drug, and Health Administration, the FDA, after product testing, it was confirmed with the Centers for Disease Control and Prevention, the CDC, that a strain of Salmonella, Tennessee was linked and found to open jars of Peter Pan and Great Value peanut butter that are both made in a single facility in Georgia. The consumption of Peter Pan peanut butter and Great Value peanut butter were both statistically associated with illness and therefore were the likely source of the outbreaks. As of March 7, 2007, 425 people within the 44 states were infected, and 20% of those people were hospitalized. Moving forward, the main problem addressed was finding what was causing the production of peanut butter to be contaminated, specifically in Peter Pan and Great Value peanut butter. Some strengths of public health surveillance related to this case would be the CDC's outbreak response team. One of them would be PulseNet, which is a network coordinated by the CDC for foodborne disease surveillance. Regarding this case, PulseNet identified a gradual increase in cases of Salmonella, Tennessee. By identifying ongoing foodborne outbreaks, health officials can stop or prevent other outbreaks. Another network that's coordinated with the CDC would be OutbreakNet, and this is a national network of public health officials that investigates disease outbreaks. In this case, OutbreakNet helped the CDC to identify and investigate the Salmonella, Tennessee outbreak. And this allows for opportunities such as surveillance. It enables opportunities to obtain information on Salmonella. In order to do this, there would have to be DNA testing and serotyping involved, and this allows for monitoring Salmonella infection outbreaks. The main focus of the cause for the outbreaks of Salmonella, Tennessee infections linked to peanut butter is that illnesses were associated with the consumption of either of the two brands, Peter Pan and Great Value peanut butter, produced at the same plant. Also, the products with the product code 2111 were identified as the contaminated products, and illnesses were also linked if peanut butter was consumed more than once per week. The opportunity this case provided was to recall the products, and this ensured more surveillance and healthy regarding the food industry. The health belief model is a theoretical model that can be used to guide health safety and prevent diseases. It is one of the most widely used models for understanding health behaviors. To connect the understanding of the health belief model and the outbreak of Salmonella, Tennessee infections in peanut butter, there are two approaches that I provided. The first approach would be to have stricter food industry guidelines to ensure safety upon manufacturing factories and the companies selling the peanut butter. A second approach would be for the FDA to research the pathogens in the peanut butter to prevent bacteria in the product. A recommendation for stricter food industry guidelines would be to warn manufacturing factories to not depend on negative Salmonella tests. The manufacturing factories should only obtain peanut products from suppliers that have validated procedures to reduce Salmonella contamination. A suggestion for the second approach for the FDA to research the pathogens in the peanut butter to prevent bacteria in the product would be for various processing methods and trials to know what the specific conditions are for the safe peanut butter. For example, they should be able to test for Salmonella in specific temperatures, whether the product needs to be refrigerated or in room temperature. Continuing on with establishing an action plan. The essential steps. The first one would be for the CDC and FDA to monitor the reports of foodborne illness related to the Salmonella outbreak in peanut butter. Then they should investigate the company's products that were reported to be infected. The next step would be to recall the company's peanut butter and hold off on marketing sales. Then they should study more cases to collect more database. And finally, they should suggest that the FDA sends public health officials to work with suppliers to ensure that the peanut products have been made and packed using current good manufacturing practices. Overall, the CDC and FDA are highly organized when it comes to food handling and salmonella infection outbreaks. I believe that the ordered system surrounding food safety is overall well maintained and they ensure hygiene and prevention of foodborne illnesses. I think that there is sufficient information provided by these agencies to educate the public about outbreak